Welcome to this presentation. We are going to look at health, wellness, and illness. So, by the end of this presentation, you should be able to define the concepts of health, wellness, and illness from the perspective of nursing. Two, you will be able to identify the factors that influence health, wellness, and this can be biological, psychological, social, environmental, and cultural. And then we shall also look at the different models of health and illness. Okay. So health is quite difficult to define, and the reason is because uh, people's understanding of being healthy is quite different, and therefore, traditionally, health has been understood or has been defined in terms of either absence or presence of a disease. So that is how health has been defined. And then Florence Nightingale, um, her perspective is that um, health is a state of being well and utilizing one's full potential. Okay, and then the widely used definition of health is that it is a complete, it's a state of complete physical, mental, and social well-being, and not merely the absence of disease. What we should note is that health is quite dynamic. That means that um, it is not constant. It keeps on changing as individuals move to new environments and then adopt or adapt to this new environment. A similar term is a related term is illness, which is basically an abnormal process that impairs functioning in the dimensions of health, for example, physical, mental, social, and even environmental. And we shall look at basically what illness is in our subsequent slides. When we talk about the philosophical views on health, um, we are basically referring to how health can be regarded or how different people actually look at health. One is that health can be looked at as a fundamental human right. With this, it means that everyone has the right to attain optimal health, regardless of, uh, let us say, their socioeconomic class, regardless of their tribe, regardless of any defining characteristic. And therefore, the governments are responsible for providing healthcare services because it is the right, it is amongst the fundamental rights of all citizens of a given country. And then the second philosophical view is that health is not solely dependent on medical care, but it is also related to the fact that one should be living a productive life where you fulfill all uh, your occupational, social, and other obligations. And therefore, that's basically what we call a productive life or fulfilling life. And then the other philosophical view is that health is very important because it is related to development. It's also related to the quality of life, and therefore it is an important aspect of of the society. Okay, you're welcome. Let me check who this is. Peter. Peter, the one who has just joined. I guess you can see this the screen. So yes, I was explaining
Yes,
that
I'm seeing, yes.
the health is an important aspect of the society, and it is linked to development and improve the quality of life. So that means that if we want to create development, it is very important to invest in health. And then the other perspective is that health carries an international responsibility. Okay, and also individual state involvement is very key. This is to say that individual governments are responsible in improving health. Important in improving health. Just a minute. Okay, they are very important in improving health, and also countries across the globe are responsible for making sure that international health or health at a global arena is actually good, because um, we know that we have diseases that can cross borders, and therefore it is the responsibility of the international community, international agencies such as WHO to make sure that their policies and guidelines on how to control pandemics or diseases that affect numerous countries. So therefore, health is a matter that is international in nature, but also national, where governments are supposed to make sure that its citizens are actually having optimal health outcomes. And then the other thing is that maintaining health is a significant social investment and a global goal. So this is linked to the earlier explanation, which is that uh, uh, health is a global goal. That's why we have what we call the sustainable development goals. These are goals that are being set um, um, to make sure that countries commit to making sure that they actually achieve these goals or targets. So health is an important investment that countries or governments should make sure that they invest in order to, to result into development. So different professionals look at just a minute. Okay, so let's continue. Different professionals have different views on what health is. Biomedical scientists emphasize a lot, or they actually rely a lot on the germ theory, which basically focuses on microorganisms that cause diseases. So their understanding of health is mainly focused on the fact that we have microorganisms that cause diseases in humans. And then the ecologists believe that humans should stay or should live in equilibrium with their environment. And therefore, any changes within the environment can result into diseases that can affect human health. And then sociologists believe that health is influenced by social, psychological, cultural, and economic factors and political factors. And therefore, the way these factors influence health is in how symptoms can be interpreted, in in the behaviors of seeking for help, can also influence the different ways of health promotion or adoption of health behaviors. All these can influence health, and therefore that's the view by sociologists. And then we have those who have a holistic view on health. For these, they actually look at all the different perspectives on health, and therefore they regard health to be a multidimensional concept that looks at the biomedical view, the the biopsychosocial view, all those perspectives. It looks at that. So we look at what wellness is. Wellness refers to the state of optimal health and overall well-being that goes beyond the absence of illness. So it looks at physical, mental, emotional, and social well-being, and therefore the role of nurses is to promote and maintain wellness in patients by providing holistic care that looks at not only physical health but also mental, emotional, and social aspects. So wellness is not necessarily about absence of disease or absence of one illness, but it encompasses all other aspects. So it is more broader. So wellness has different dimensions: environmental, occupational, intellectual, spiritual, physical, emotional, and social. So we're going to look at each of these. The physical dimension focuses a lot on the ability to maintain a healthy body and lifestyle that allows one to perform daily activities without undue fatigue or stress. So activities related to making sure that you can exercise, you feed regularly, you can have adequate sleep, you are not abusing any harmful drugs, and you can seek for medical care when needed. These are aspects to do with physical dimension of health. Okay, so this is basically related to how you can maintain your body healthy. And then social dimension is about how you relate and maintain relationships with relatives, friends, in a productive way. Also relates to how you can maintain and develop and maintain intimacy. So it's about social relations basically. Emotions, it deals with how you can manage your emotions, especially during stress, being able to manage daily stress, and being able to express and even manage your emotions is very important. And then intellectual dimension is related to cognitive skills, which relates basically to the ability to learn and even be able to comprehend information. This is very important in health education and in educating patients about taking their medications and things like that. Spiritual dimension is the belief in some force that serves to unite. basically one's spiritual well-being is related to what they believe in. Uh, they with Christians and they Muslims, what do they really believe in? That is their spiritual well-being. And then occupational dimension relates to the fact that one can have the ability to balance between work and leisure, because work is associated with stresses, and then also social life is also associated with its own pressures. So the ability to navigate between work and social life and leisure is very, very important. That is the occupational dimension. And then we look at the environmental dimension, which is basically relates to the ability to appreciate and protect natural environment, natural resources and ecosystems that sustain life on Earth. And in this dimension, one should be aware of the impact of one's action on the environment and taking steps to protect the eco footprint. Okay, so environmental wellness also includes one's ability to advocate for environmental justice and sustainability. So therefore, the discussions that we have had illustrate that if one is at the higher end of wellness, which you are referring to as high level of wellness, then the following will manifest: that the person will have a positive outlook towards life, person will have a high level of self-esteem. There, just a moment. So I was for someone to attain high level of wellness, um, they will exhibit the following: one, that they will have a positive outlook towards life. There will be people who are very optimistic, people who believe in themselves, people who have a sense of purpose, people who are confident. They feel that they are in charge of their life. They have a good sense of humor. They enjoy life. They respect others and the environment, and they have that cautious commitment to personal excellence. And then they live. They have a sense of balance and integrated lifestyle. This is to say that they actually master the art of balancing between their professional commitments and social life and or personal or family life. And then of course, they are not addicted to substances, so they don't have addictive behavior. They can cope up with various stresses of life. They are well conditioned or well groomed and also physically fit. They have the capacity to love and an ability to care for others. And then they can be able to navigate or manage life demands. And of course, lastly, they have the capacity to communicate effectively. So let's look at the term disease. A disease is basically a pathological change in the structure or function of the body or the mind. Okay? Just one thing here. Okay? So whereas illness is just somebody's response, someone's response to a disease. Okay, so an illness is an abnormal process in which the person's level of functioning is changed when compared to the previous level, and it can be as a result of a disease or not, but also it encompasses um, physical emotional, intellectual, social, developmental, and spiritual aspects. Okay, so illness can be looked at as a personal state in which the dimensions of physical, emotional, intellectual, social, developmental, and spiritual functioning are diminished or are thought to be diminished. Okay, and then disease causation is what is referred to as etiology. Okay, and I've said that illnesses can be associated with a disease or not. So, health transition is an important term that we need to understand. One is that um, we said that health is not static, health is dynamic. That means that it keeps on changing. Okay, so there is change in health behavior, in health status, and therefore it is very important for us to be aware of the changes that an individual is going through, and this will allow us to enable them adopt appropriately. So let's look at the different models of health transition. We have what we call health illness continuum model by Treffis, and then we have the high level wellness model, the ecologic model, health belief model, and the holistic model. So we're going to look at each of these models. The health continuum model believes that we have two extremes shown by the arrows in opposite directions. We have the arrow towards the right and then the arrow towards the left. The arrow towards the right points to positive or good health, and the highest level is the high level wellness that one can achieve, whereas the arrow towards the left demonstrates poor health. Okay, and it culminates into premature death. Okay, so the neutral point is what you can refer to as the normal point. Okay, the discernible illness or wellness. Okay, so to move towards the right, interventions such as awareness, education, and growth should be done, should be carried out. And then in the side of poor health, it starts with signs, symptoms, and disability. Okay, so the implication here is that nurses should be aware of the level of health that clients are having. Okay, so you want to make sure that patients or clients are facing the right side. Okay, where you have increasing health and well-being, and therefore we should have efforts in awareness, education, and growth. If the patient is facing or moving towards the left, then you are likely going to have premature death. Okay, and the progression includes the signs, symptoms, and then disability, and eventually death. So the implication is that we should be able to know the stage of a client's health and be able to act accordingly. by recognizing the risk factors that may be causing the person to be facing towards the left. And if we are to prevent illnesses, we should create awareness and also educate the client. So we move to the next model, which is Dunk's health process model. With this model, health is looked at as an ongoing process towards an individual's highest potential functioning, and it involves dimensions to do or aspects to do with the person, the family, and the community. To illustrate this model, you need to use two axes. The x-axis, which is basically for health, where you have the peak of this axis demonstrating peak wellness, and then the other end demonstrating poor health, basically death. Okay, and then you have the y-axis, which shows an extreme of a very favorable environment and the other extreme of very unfavorable environment. So when you have that kind of graph, you will have four quadrants. The first quadrant will be one that shows high level wellness in a favorable environment. This is what you would want to have for your client. And then quadrant 2 is where you have protected poor health in a favorable environment. Okay, it's the person who is having a health condition but is in a favorable environment and they can be managed. And then you have the quadrant number 3, where you have a person in poor health and also in unfavorable environment. And then quadrant number 4 is the emergent high level wellness in unfavorable environment. So let's look at what we call the agent host model. This model stresses that diseases can emerge as a result of a lack of balance between the environment, the agent, and then the host. The host being the organism that can be affected by an agent, and the agent being a microorganism or environmental factors that can cause illness. And then the environment basically looks at the circumstances surrounding the host, or where basically the host lives. Okay, so for example, if you're going to look at a condition such as malaria, we are going to have the host being the human, and then there are humans that are actually susceptible to malaria, pregnant women or even children under the age of 5. So these are susceptible hosts. And then the agent being Plasmodium species. And then the environment that can promote the breeding of these mosquitoes, a bushy environment, an environment with stagnant water. Okay, so the environment promotes the breeding of the agent that can cause diseases to susceptible host. So that is basically the agent host environment model. And then we move to what we call the health belief model, which is commonly used in health promotion. It looks at the factors that can enable individuals to carry out health behaviors, practice or not to practice health behaviors, the factors that influence uh, the practice of health behaviors. So these factors can be psychological or can be related to demographics. So we look at concepts such as perceived susceptibility, which is that what someone's perception on whether they can easily get the condition will determine whether they will carry out the health behaviors or not. And then perceived severity, which is basically related to whether one believes that the disease is a serious one that can cause death or one that is mild. And then their level of motivation, okay, that is health motivation. And then perceived benefits. If someone is going to engage in health behavior such as exercising, what benefits would they derive? Okay, and that perception influences whether they would exercise or even eat healthy foods and other health behaviors. And then perceived barriers. What are those factors that a person may think may limit them from practicing the healthy behavior? And then we have what you call the choose to action. What are those factors that can prompt an individual to perform the health behavior? And those are the choose to action. Okay, so that is the health belief model, that we have different factors that influence health behaviors, and the understanding of these factors is very important in health promotion and adoption of health behaviors. The holistic model looks at all the other dimensions of health and therefore incorporates those dimensions of biological factors that influence health, psychological factors that influence health, and then the social factors and the spiritual factors. So it therefore looks at all the other dimensions of health. The health promotion model defines health as a positive, dynamic state and not just the absence of disease. It emphasizes the importance of behavioral sciences in bringing about health promotion and health promotion and well-being. So it looks at two aspects: there's health promotion and health protection, where health protection is a reactive approach that prevents specific diseases, illnesses, or health threats. So it's about safeguarding health, okay, when risk factors or threats have been identified. And then we look at health promotion. Okay, health promotion is a proactive approach that aims at enhancing overall well-being and preventing onset of illness or disease. The other models that we can talk about include the clinical model, which is basically related to the biomedical model, that is health is the absence of signs and symptoms of a disease. Okay, so it's about either presence or absence of a disease. And then the role performance model looks at health in terms of one's ability to fulfill their societal roles. It is taking care of the family, being a protector, giver, things like that. The adaptive model looks at the fact that an individual needs to adapt to changing circumstances. So the ability of one individual to adapt is very, very important in responding to the environment. And then the monastic model looks at it has a comprehensive view of health. It emphasizes that health is a condition of actualizing or realizing one's potential. So we have already in our discussion, we have looked at the different dimensions of health, basically different ways in which health can be affected. Okay, so these factors can be categorized as individual factors, okay, what you call internal factors. One's genetic makeup, one's age, one's emotional factors, cognitive factors, all these influence health, just as we had looked at earlier on. And then we have those factors that influence health that are actually external. Okay, issues to do with where one is actually living, the job that they have, how much they earn, and the level of education that they have. These factors are external and influence health. So how do individuals transition from health to illness? Okay, so what stages do they go through in developing an illness? Usually illnesses start with non-specific symptoms that initially the person may attempt to deny. But of course, as these symptoms intensify, they start to feel unwell. They start to feel pain. They start to feel discomfort, loss of energy, and also fear. And then another phase comes in where they start to acknowledge that they are not well, and action is to be taken. So this is the moment when they start to depend on others for physical or psychological reasons. And then if action is taken, they can recover, and basically that is the convalescence, which basically marks the transition from health, from illness to health. Illnesses can be classified into two: acute illness, those that last for a short duration, and then chronic, these ones can last for an extended period of time. So Suchman came up with the 5 stages of illness. First is the symptoms experience. This is where someone starts to feel the actual symptoms of an illness. So they are aware that they are not well, they have a problem with their health, and they start to make interpretation of what they actually feel. Sometimes they can respond to this with fear or anxiety. And then the self-treatment stage is when someone now takes action to make sure that they relieve the symptoms. It's when they can buy over-the-counter medication or take what we call home remedies, such as maybe herbal drugs or herbal or honey or other homemade products. Okay, and then the next stage is that they start to communicate with significant others, or for example, the relatives or the family members, about the fact that they are not actually feeling well. And this is at the point where they actually get validation for how they are actually feeling. Okay. Um, and then the fourth stage is when now they accept that they are actually not well, so they take on what we call the sick role. Okay, with this role, um, this is where they actually have to be dependent on other people to to accomplish their responsibilities. Okay, so that means that at this level they are not able to perform certain responsibilities, and they may need to depend on others. So this is where you have physiological and psychological dependence. And then we have recovery or rehabilitation, which is the last stage um, of this, of the last stage for this, for the 5 stages of illness, which is basically recovery or rehabilitation. Uh, Convalescence is basically recovery. The person is now moving from illness back to health. They are recovering from the condition. Okay, um, so sometimes they may be recovering with the residual effect, or a disability that may require rehabilitation. Egun came up with the 11 stages of illness, and we'll look at them here. 1, symptoms experience, which is basically related to the first one. The person starts to know that there is a problem with their health, and then they start to make meaning out of that. Then they start to seek medication on their own, maybe take home remedies or even get over-the-counter medications. They communicate with significant others, especially family members, about their state of health. And then they assess and analyze their symptoms more in detail. That is when they can ask people with medical knowledge or use relevant resources on the internet to be able to understand their disease. And then now they assume the sick role. Okay, this is where they depend on others. So number 6 is that they express their concern and fears about their health openly, and they have to they seek emotional support from family and friends. And then stage 7 is when they start to evaluate whether the treatment is working or not. Then 8 is that based on their assessment, they can either continue with the treatment or modify it. Of course, they may have to consult the health professionals to make more informed decisions. And then they now implement the chosen treatment. And then the stage 10 now involves evaluation of the effects of the treatment and whether there is need to make adjustments to the treatment during this stage. And then the last one is recovery or rehabilitation. So let's look at the changes that happen during illnesses. Illnesses will cause a number of behavioral and emotional changes in our clients, and these may include reduced ability to do physical activity, changes in eating habits, adherence to medication, increased dependence on others. The emotional changes that may occur include anxiety, fear, depression, sadness, frustration, irritability, and coping mechanisms such as withdrawal or seeking social support. Others will have what we call loss of autonomy, where they can no longer make their own decisions, so they depend on others to make these decisions about their health. And therefore, they need a lot of assistance in even the daily activities of living. Things like personal hygiene, bathing, dressing, and moving around. At this stage, they don't have full control over their bodies and they need support. Other things are related to issues to do with self-concept, how they perceive themselves, whether they start to evaluate their worthiness, they start to have alteration in self-esteem, okay, and then they start to re-evaluate their um, personal journeys, goals, values, and priorities. And then illnesses can also cause lifestyle adjustments. This can happen where if a significant person within a family uh, gets an illness, it means that many things will have to change in their lives. Issues to do with making sure that maybe they no longer go to work because they are sick. Issues to do with if they have been the breadwinners, then the family may have to suffer in terms of access to the things that the sick person has been assisting or has been providing. So you have financial difficulties, and then you have modification of social activities and relationships and things like that. The families will also be affected by illnesses. Okay, you will have family members taking on other roles that they have not been taking. So, for example, like I said, if a significant person who I can call a breadwinner at home gets sick, then those who have not been working will have to seriously look for what they can really do in order to support the family. So different people will take on different roles. Sometimes you will have women stopping what they are doing, their work, in order to be caregivers. So these are things that will happen because of an illness. Okay, so um, different people will take different tasks in order to support the person who is actually ill, by either making sure that their appointments are made, they can remind the sick person to take their medication, and also assist them with daily activities of living. Okay, so illnesses can really have increased demands on families, where they have to check the sick person regularly, where they have to support them with the daily activities of living. But again, at the same time, they need to make sure that they need to make sure that they can balance those duties with their work and also household duties. So it can be quite challenging. We also have increased anxiety. Okay, the family members get worried about the well-being of their loved ones. Financial issues will also arise if especially the person who is sick overstays within the hospital or who will have to undergo expensive treatments or surgeries. So this will lead to financial constraints. And then also sicknesses associated with societal social customs. Okay, so uh, we already said that social dimension affects how health and illness are interpreted and how symptoms are interpreted, and also issues to do with health-seeking behavior. These are all influenced by social customs. So illnesses, in the same way, uh, result into changes in social customs. Okay, so thank you very much for attending this session. This session ends here.